Hey there. Welcome to my office. You must be my cranial nerve patient. Good. Okay. Well, are you familiar with what a cranial nerve exam is? You are? Good. Well, that saves me some explaining. With that said, this is going to be a rather extensive cranial nerve exam. I want to touch on every basis, okay, each one of your senses, and I'm going to really dive into it and make sure that, you're squared away before I send you home, okay? As you know, these are pretty simple. All I need you to do is just sit back, relax, and enjoy the process. Trust that you're in good hands, and I will do the best I can to make sure that you feel comfortable and safe. And again, if there's anything during these tests that make you uncomfortable, please let me know. I'd be happy to get it mediated for you, okay? So I'm just going to start at the top, rather, and we'll just go down. So I'm going to go ahead and probably do a little hands-on test, make sure you're feeling everything okay, and then we'll move on to the vision and so forth and so on, okay? Sure thing. Let me get my gloves popped on and we'll get started, okay? And with this portion of the test, I'll also want to check your heart rate and give your lungs a quick listen just to make sure that your breathing sounds good and that your heart is nice and strong, okay? And again, there's no worries at all. This is very standard practice and just sort of helps me establish a baseline for your overall health, and also allows me to kind of hear your internals and see how you're doing, okay? So go ahead and knock that out first. So I'm going to get a little closer, okay? Listen to your heartbeat first. So here we go. And just breathe normally for me. Good. Good job. Perfect. Good. Very good. You sound very healthy. Good. Very good. Okay. Now what I want to do is listen to your breathing, so I'll put this stethoscope here towards your side on your rib cage, your abdomen area around back, and just have you breathe. Follow my instructions on this one, okay? Cool. All right. So on my count, just breathe in deeply and hold it, okay? 1, 2, 3. Breathe in deep. Hold. Exhale. Good. And breathe in deep. Hold it. Exhale. Okay, breathe in very deeply now. 1, 2, 3. Breathe in. Hold it and exhale. I'm just going to come around back here. Okay. Okay. Breathe in deep. 1, 2, 3. Breathe in. Hold it. Good. And exhale. One more time. Breathe in deep. Hold it. And exhale. Okay, well, I got good news. You sound exactly like you should. So that's good. You passed that portion of the test with flying colors. I'm gonna go ahead and log our results here, and then we'll get started on the feeling portion that I was telling you about previously. Okay. And this notebook is gonna just allow me to record our findings here. Okay. I like to do things the old school way. Essentially what I wrote is that you passed that portion of the test, okay? If you want to call it a test. Okay. Okay. So what I'm going to do here is I've got this pick here. It's not too sharp, okay? It's just pointed, and I've got this brush here, okay? And what I'm going to do is have you close your eyes, and I'm just going to gently either poke you with this pointed tip or softly brush your face with this brush, and you just tell me whether it's hard or sharp or soft. Okay? Sounds pretty easy. Yeah. Okay. Well, it is pretty easy. So go ahead and close your eyes for me. I'm gonna get a little closer here, and we'll begin the test. Okay. Okay. Perfect. All right. So sharp, good. Soft, good. Sharp. Soft. Soft, good. Sharp, good. Soft, yes. Soft, perfect. Sharp, yep, good. Sharp, good. Soft, good. Sharp, good. Sharp, good. Soft, soft, sharp, soft, sharp, sharp, good. Soft, good. Sharp, sharp, good. Soft, good. Soft, good. Sharp, soft, good. Okay. Well, my friend, it seems to me that you have no issues at all determining the soft from the sharp, which tells me that the nerves in your face are working exactly as they should be. So again, you've passed that little portion. What I'm going to do now is just a continued. This particular test is feel around your face, okay? I'm going to pat in your eye socket, kind of around your eyes, above your eyes, and your cheekbones, okay? Jawline, neck area, forehead, brow, all that stuff. And while I'm doing this, I'll be feeling for any knots, bruises, anything of that nature. And if any of this is uncomfortable, okay, if there's any point in which I touch your face and it causes you pain, please let me know. And we'll take a closer look, okay? Good, perfect. All right, well, you can keep your eyes open or closing for this portion. I'll go ahead and get started, okay? Perfect. All right, here we go. any discomfort there along the eyes? No. Okay. Now I'm just feeling above your brow here. Doing so on the right side, and then we'll go to the left side. Is there any discomfort there at all? No? Good. Good, good, good. And just feeling above your brow line again here. Tap, tap, tap. Tap, tap, tap. Was any of that uncomfortable? No? Good. Okay. Beautiful. Now I want to feel around your cheekbones. Okay, so. How's that feel? Okay. No discomfort there, I trust. Okay, good, 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 good. And under your chin here. Just gonna tap, tap, tap. Is that uncomfortable at all? Good, okay. Perfect. Let's go ahead and check your forehead here. Any of that uncomfortable at all? No, good. Okay. And last but not least, I'm going to go ahead and check your neck area and your lymph nodes, okay? Good. Is that uncomfortable at all? Okay, good. I'm not feeling any swelling at all. So that's good. No swelling at all. You do, however, feel a little bit warm around your neck. Have you been noticing the chills or anything like that? You think you might have a fever or anything? Okay, have you been sick at all in the past week or so? Just had a little cold. Okay. Let me go ahead and check your temperature while you're here, okay? Just to make sure that you're not infected with anything viral, okay? Cool. Okay. You just sit still for me, okay? All right. .5. So, pretty normal there. No concerns at all. Place this back in our container here. Okay, so obviously you're able to feel everything feels good in the face, no issues with the nerves in the face. And then again, you didn't feel any discomfort when I was tapping around your facial structure or anything like that. So I don't see anything to be concerned about there. I'm going to go ahead and log our notes real quick, and then we'll move on to the vision portion of the test, okay? Good, perfect. You're doing a good job, by the way. Keep up the fantastic work. Now what I want to do is get some really basic standard measurements from your face, just to have a log and make sure there's no changes next time you come see me. So I'm going to get our little tape measure, and I'm going to go ahead and get started on that test, or process. So all I need you to do is just sit still and relax, and I will just begin getting my basic measurements, okay? So what we're going to do first is go eye to eye here. Okay. And getting your nose here. Good. Chin to cheek. And it is exactly symmetrical with your other side, so that's good. Let's go ahead and get your forehead now. Just making sure that everything is as it should be. Good. And lips. Good. And now we're going to get the sides of your face here. And that looks good. How about this side? It should be the exact same, give or take a millimeter or so. And it is right on target, so that's good. Now I just want to get your jawline here. Good, and it's the exact same on that side as well, so. That's exactly what we're looking for. Great job. Great. Okay, my friend. Well done. For this test, I'm going to get my ophthalmoscope out. We're going to take a little close look at your eyes and your pupillary response. Okay, you have any trouble seeing vision, whether it's far, close, color, anything like that? Okay, so nothing really comes to mind. Sure. So I don't think we'll have anything to be concerned about, but we always want to take a look anyways. The first part of this will be just a quick check of your pupils, make sure that they're dilating accordingly when I introduce light to them. And then I'll have you perform a series of tests involving peripheral vision, as well as your ability to follow my fingers and use your eyes to track my fingers. So first things first, I'm going to go ahead and pop this on, get a closer look at your eyes, okay? Perfect. So you just look at my finger here. Look at my finger, good. Good, keep looking over my shoulder. I'm going to check your left eye here. Good. And it's responding beautifully. No issues at all here. Good. All right, now I'm going to check your right eye, same thing. So just look over this shoulder now, okay? Just look right here, my finger, good. Keep looking at my finger. And I'm going to pull down your lid here on your right eye. Look right here at my light now, please. Good. And I don't see anything to be concerned about there. Good. So we can place this ophthalmoscope down. I'm not an eye doctor, general practitioner, but this is usually what an optometrist will use. I like to use this tool just to get a directed look into the eye and pupils, to see pupillary response, just to make sure that your eyes are working at the bare minimum, reactive how they should be to the light stimulation. So I'm going to go ahead and put this tool down, and then we'll move on to just a basic flashlight and have you perform a series of tests, okay? Good. All right. Okay, I've got my flashlight here. It's not too bright, hopefully, but I need you just to follow my directions here, okay? All right, good. So, without looking at my light, focus on my finger. And I'm just going to have you follow my finger using your eyeballs only, okay? Don't move your head at all. Good. Good. Follow my finger, follow my finger. Good. Coming closer now. Good. Follow my finger. Good. Follow my finger. Follow my finger. Good. Good. Good, good, good. Back, 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 back. Follow it. Good. Perfect. Okay. Now we're going to do the exact same thing, but with the other eye. So, again, without looking at my light, keeping your head completely still. Follow my finger. Good. Good. Coming closer and closer. Closer and closer. Follow my finger. Follow my finger. Good. Good. And now back. Good. And follow my finger. Good. Okay. I'm going to go ahead and take another look at your pupils here. I don't see anything to be concerned about, but I always want to make sure I dive in really close, okay? So I am going to get rather close this time, if that's okay with you, face to face. And take a closer look at your eyes, okay? We're going to start with your left eye, and then we'll go to your right. Is that okay? Good. Okay, here we go. And taking a look at your left eye here. Good. Pulling down your lid and pulling up your lid now. Good. Very good. And no issues there with the pupil area response. Beautiful. Very good. Now we're going to do your right eye, okay? Wonderful. Here we go. Pulling down your lid here. Pulling the lid down. Good, good, good. And pulling it up now on your right eye. Good. Okay. The eyes are looking fantastic. That'll do it with our light. I'll go ahead and put this away, and I'm just going to have you, again, follow my fingers, okay? Cool. Okay, for this portion, very easy, okay? I'm just going to have you follow my fingers, okay? So let me know when they come into your peripheral, into your vision, okay? Good. 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 Good, good, good. Okay. Now, a very basic test here. I just need you to tell me which one of my fingers is wiggling. Keep your head completely still. And let me know which finger wiggles. Just point at it, okay? Cool. All right, here we go. You're doing a good job, by the way. Yep, good job. Yep. 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 Good. Yep. Good. 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 Good work. Okay. You passed that portion of the test also with flying colors. I see nothing to be concerned about. Really briefly, I do want to check your vision and see if you are able to see colors well. Okay, so really standard, basic test here. I'm just going to point at a color and you let me know what color it is. Cool. Okay. You tell me what color that is? Yellow, good. What about the cheeks here? Red. Yep, that's right. Can you tell me what color this is here? Blue. Beautiful. And what about this color here? Sort of an aqua green. Yep. Good. Very good. Okay. Now what I want to do is just have you tell me how many fingers I'm holding up using your peripheral vision. So just focus here on my nose, and I'm going to have my hands up like this, and you just let me know how many fingers you see, okay? All right, so 3, yep. 4, 6, good. 10, perfect. 2, 2, 2, 3, 6, 8, 7, 5, good. 2, 2, 1, 4, 3, 3, 10, 5, 5. Good job. That's perfect. I don't see anything to be concerned about at all there with that portion of the test either. So far we got your touch, sense of touch. We got your eyes taken care of. Now we're going to go ahead and move on to your ears. And this is a very easy test as well, but it's one that a lot of my patients find quite relaxing. So what I'm going to do is lean in a little closer. I'm just going to whisper words to you, and you just let me know what words I'm saying. I'll get gradually quieter as this test progresses, and it shouldn't be any trouble for you to pick up what I'm saying, okay? Cool. All right, so I'm going to get a little closer, and you just repeat the words I'm saying to you. Purple. Good. Green. Green, good. Red. Good. Brown. Good. Saturday. Yep. Monday. Carpet. Carpet, yeah. Paint. Paint, good. Toilet. Toilet. Toilet, yeah. Clothing. 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 Clothing, yeah, good job. Jacket. 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 Jacket, good. Keyframe. 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 Keyframe, yep, good job. Building. 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 Building, good. Football. Football, football, football. Football, good. Basketball. Yep. Baseball. Good. Soccer. Good. Misunderstood. 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 Yep. Optimal. 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 Good. Swimming pool. Swimming pool. Swimming pool. Swimming pool. Good. Product. 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 Good. Lipstick. 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 Good. Blush. 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 Good. Great job, my friend. That is a good job. Now I have two different tuning forks, and I'd like to test your hearing with those as well. Two separate frequencies, and what I'll do is I'll activate the tuning fork and gradually move it away from your ears. And you just let me know when you can no longer hear the frequency being emitted, okay? Great, sure thing. Okay, we'll start out with our higher pitched one, so just let me know when you can no longer hear this. Good. 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 Great job, my friend. And now we'll move over to this one that's a little bit lower, but should still be easy enough for you, okay? Cool. Good. Good job. Great job. Okay. That's a easy enough test. And with the hearing and the vision, you both passed both of those with flying colors, so good job. I didn't think you'd have any issues with those, to be honest. Now what I want to do is take a look into your ears, just to make sure there's no blockages or any wax buildup that we should be concerned about. Okay, so I'm just going to get my ophthalmoscope, change the tip out, and I'll take a look, okay? Good, all right. Okay, so just sit still. I'll pull your ear down like so, and take a quick look. All right, good. And just checking for any wax buildup. And so far, that right ear is looking very clean, very, very clean. And we'll go ahead and check out your left ear now. Pulling down your left ear. And that left ear is also looking very clean, so I don't see anything to be worried about at all there either. I'm going to go ahead and place our tools back where we found them and write down our findings, and then we'll move on to the smell test. Does that sound good? Cool, all right. Okay. Now, as far as your ears go, you've been hearing everything okay, I trust. Good. And like I said, I didn't see any issues at all there, so everything checks out. You're doing a great job. Again, keep up the good work. And for this portion, I have a series of scented liquid that I will disperse in the air in front of you. Just kind of waft it towards you, and it shouldn't be any issue for you to figure out what the fragrances are and report back to me what you think. Sure, okay. Okay. This is our first one. There are actually 5 of these, all very distinct fragrances, so you should be able to discern the differences and figure out what they are individually, okay? Cool. All right, so here's our first one. Lemon. Yep, perfect. Great job. And this one. That one is coffee. Good job. That's a very good smell. It's more of a vanilla bean sort of coffee, but it's still coffee. So good job. Okay. Yes, that one is a vanilla fragrance. Good job. I like that one a lot too. Here we go. Yeah, it's lavender, actually. Good job. Close enough. That one's kind of tricky. A lot of people really don't know what lavender smells like, but you must have grown up around candles, so good job. And last, but very not least, you ready? Good, here we go. That one is leather. Yeah, that's not an edible, but it's leather nonetheless. Very distinct smell, more of a sandalwood kind of fragrance, but close enough. So, good job. You are doing a great job, my friend. And for our next portion of the test, and our last portion, we're just gonna test your taste Essentially, just going to use a couple artificially flavored liquids to apply a few drops to your tongue, and you'll just tell me what you taste. It's just as simple as that. So, does that sound good? Okay, cool. We'll get started now. So, go ahead and stick your tongue out. And can you tell me what you tasted there? Coffee, exactly. And go and stick your tongue out. Good. What do you taste there? Cinnamon. Perfect. Yeah, that one tastes a lot like Christmas, so I like that one a lot. Okay. Just a few more. Stick your tongue out for me. What's that one taste like? Apple. Beautiful. Sour apple, actually. Yeah, good. And last but not least, what's that one taste like? Vanilla, yeah. Yep, that one's really good too. So, you passed that portion of the test with flying colors. What I do want to do while I have you here on the mouth portion of the test is just have you open up real wide. I'm going to get my light and take a few quick looks at the back of your throat just to make sure you don't have any irritation or anything abnormal going on back there. Does that sound good? Wonderful, okay. Okay, open up wide for me. And good, go ahead. Put your tongue to the roof of your mouth, like so. Good. And stick your tongue out wide. Good, to the left. And good to the right. Good, now, if you could, one more time, to the roof of your mouth, open up wide like this. Good. Okay. Well, my friend, everything looks like it should. And with that, that will make up our test. Go ahead and write my findings down, but between me and you, you passed it with flying colors and really didn't see anything out of the ordinary, so. But now at least we have a baseline for next time when you come in. We'll know sort of what to look for. But if you don't have anything else for me, you can go ahead and get out of here and have a fantastic day. Sounds good, my friend. Well, it was a pleasure seeing you today, going through this exam with you, and I hope that we can continue this in the future.